how our relationships to disease states such as heart disease, there's lots of genetic related, diabetes, what role genetics play in that as well. Alterations, undernutrition, insufficient, children are the most visible victims, increased risks of infection, slower bone development, stunting of their height, learning disabilities, failure to thrive. The malnutrition can range from mild to emaciated. We have seen all those TV commercials from other countries, some of them very emaciated children. Skin will be dry, scaly, brittle nails, rashes, hair loss. Mouth will have ulcerations, changes in the tongue. Muscles, decreased mass, weakness, fatigue. CNS, there would be mental changes, confusion, irritability. The speed with which the malnutrition develops depends on quality and quantity of the protein intake, calorie, whatever's missing, and for how long. Muscle wasting, flabby, weakness, delayed wound healing, increased infection, anemia. Adolescents and young people, poor wound healing, muscle loss, chronic illness. The longer a patient is in the hospital, the more their protein loss usually is. Overnutrition seems to be rising in the United States especially due to increased intake of refined foods, the easy, quick and easy kind of packaging, linked to obesity, diabetes, cardiovascular disease, sugar intake, excess body weight, increases all mortality rates, ages 30 to 74. Prevalence of obesity, overweight in children has doubled in the last 30 years. That's alarming to think in 30 years we've doubled obesity in children. We're supposed to be living healthier, smarter, better educated, and yet that happens. Obesity is more than 1/3 of U.S. adults, 18% of U.S. children and adolescents, triple the rate from the last generation.
But back in the day, we didn't eat out like we do now.
How many of you would say you eat out 3 times a week? How many would say you eat out 10 times a week? Because I know, I'm older. Eating out, we may eat out maybe once a month, maybe. And it would be at a restaurant too.
Right.
Whenever we did go out to eat, we went to a full sit-down restaurant. We didn't go through drive-thrus. So again, when you think of our nutrition, we want it now. We want it tasty. We want it sweet. We want it pretty, and that's not always good for us, right? So when we look at our nutrition and what we're passing along to our kids, it's pretty sad. But again, the things that don't get processed, the fresh fruits and vegetables, so you can go to a farmer's market or whatever, stuff that didn't get touched very much, that's so expensive. But the things that got processed like crazy, oh, that's the cheap stuff. Oh, here's what we're buying. So we think we're getting more for our money. Oh, I can get this many items for $10, or I can get a bag of apples, But where's the nutrition? When you start thinking of, instead of how much I'm getting for my money, how much nutrition are you getting for your money? It's a much better way. So underweight, 3.5% of children and adolescents, 1.7% of adults, and 1.2% of older adults. Risk factors: food choices, allergies, lactose intolerance, adjustment of carbohydrate intake in diabetic, genetic link, increased risk of obesity with age, hormone level range, sedentary lifestyles. With the whole COVID thing, I think most people have been more sedentary than ever, right? So I wonder how our health otherwise is gonna be affected because of that fact that we weren't out doing life like we used to do, right? So I wonder how the obesity rate's gonna look very soon. And hormone level changes, body fat increases muscle mass. Related concepts, we already know, it's related to everything, right? Diagnoses include for malnutrition, impaired nutritional status, impaired nutritional intake, fluid imbalance, risk for impaired skin integrity, diarrhea, overweight, imbalanced hydration, feeding, self-feeding, self-care, nutritional deficits, impaired swallowing, obesity. Plan or goals for undernourished include achieving an optimal weight, consume a specified amount of calories per day, no adverse consequences, nutritional intake meets minimal requirement, fat intake should be below 30%, and to remove sugary beverages from our list. Health promotion thinks some things are modifiable, such as our food choices, our portion sizes, smaller plate, the my plate, you go with the fist as your serving size. Nutritional intake needs to be less sodium and less sugar and more whole grains, more fruits and vegetables. Modifications for difficult, for some people, like food sensitivities, limited income. We need to provide information for local groups and resources, dietary information, places that they can go for help, screenings, body mass index screening, teach and reinforce healthy eating habits. Interventions include environment conducive to eating. When you're in a long-term care facility or you're in a hospital care facility, if the urinal or the bedpan is sitting right out and then you bring in their food tray, is that very conducive to someone who isn't very hungry or having nutritional concerns? I've seen it happen 100 times. Go in and there's the bedpan and it's very close to where the food tray is. That's enticing, isn't it? High calorie foods, bring favorite foods. Find out what they like. And if it's something that they can't have anymore, find a way to kind of match that with something else that might be something they can substitute. They have these food tastes that they have grown accustomed to, and we just need to find ways to help them substitute better. Frequent meals, offering oral hygiene and hand hygiene, assist in a comfortable position, place bedside table at appropriate height, clear it of clutter and anything not appetizing, remove the urinal and bedpan and emesis basin, assist with setting up the tray. Sometimes they can't do that and they don't want to eat to you, they can't. So have a little conversation with them while you're helping them set their tray up. Do not interrupt their meal. Offer between meal supplements. May include appetite stimulants, or it may include some supplements like Ensure or something between meals. Common risk factors. Review their nutritional history and their assessment, their food and fluid intake, review their diet, their laboratory data, height, weight gain and a loss of weight, any interactions with food that they may have with intolerance or with the medication that they're on, what do they weigh, what's their vital signs, what's their social life, what kind of interactions do they have, and what kind of access do they have to food. We already talked about that. Observation and patient interview includes inspection for signs of malnourishment, eating habits, ability to chew, and mini nutritional assessment. Recognize for culture that many cultures do recognize both acceptable and prohibited food choices. So make sure you are cognizant of that when you're helping someone with their food choices. Diagnostic tests, the lipid profile we already talked about, CBC, glucose, especially for checking for their glucose metabolism, albumin, the pre-albumin to see what their protein status is, total protein, cholesterol. Nurses play a vital role in education. We're with patients more than, whenever a doctor writes a low salt diet, that's real easy for them to write and hard for our patients to live with. So part of it is our educating them about food choices and right decisions and how to manage their disease better. Another healthy people goal is that healthcare providers will give patients more comprehensive information. And I think that's where it's easy for us to have a list of foods on the unit, and then as our discharge teaching, we just kind of throw that list out there and say, okay, here's your no salt diet. Go away with happiness, because you can't have anything anymore that you're happy with, right? But we need to work to make those lists more individualized and help our patients get nutrition, dietitian referrals, and give them a list that they can live with. Collaborative, dietitian, nutritionist, weight loss clinic, OT, PT, refer to surgery if that's something that they're morbid obese. Over the counter, vitamins and supplements, protein drinks and powders. We don't really have a lot of medications to decrease body weight, but we do have some things we can enjoy for supplements. Non-pharmacology, therapy, weight loss. Athletes who wish to add muscle mass may choose an additional protein in the shake, additional calcium, vitamins, special diets, hypertension, hypercholesterolemia, diabetes, IBS, celiac, all those have dietary concerns. And tube feeding or the total parental feeding. Nutrition for infants, they require a unique nutritional diet based on what do we recommend that babies have for the first 6 months. They should be breastfed for the first 6 months. They triple nutrition, they're rapidly growing, they get half of what's on the plate should be fruits and vegetables. The other divided with lean meats, grains. Limit fast food, junk food. Water, milk instead of sugary drinks. Adolescents are greatly influenced by their peers, and as a school nurse, I spent lots of times both ways with girls who were not eating anything and young men who were trying to bulk up with their protein, doing things they shouldn't be doing. So with adolescents, they tend to swing in wide continuum. So you'll see it all. You'll have young girls lots of times who are trying to be super skinny, and then you have the young guys that are trying to beef up their muscle mass. Social pressures, eating disorders. As a result, most of the time when I saw them, it's because they were coming in because their heart was palpitating, or something was going on that scared them. Or they would rev up with about 4. I've had to send so many students out by ER from the high schools because they were drinking those monster drinks and having a heart rate of 250 beats a minute of, monster drinks. Well, I only had 3. Like, okay. So they need a lot because they're out in the world. When you have a child at home, you know what they're eating. But when they become adolescent and they're out of the home more and greatly influenced by their peers, sometimes you don't know what they're getting hold of. And that Monster drink, some of those just look so innocent and they're packaged so nicely, but they do have effects. Males, nutrition in pregnant women. Fetus needs the mom to be well nourished, picking the right foods so that weight is not such a problem. She needs to have sensible weight goals. Older person, unique nutritional requirements because they have lower caloric needs, but they need more vitamins. Lots of times they are undernourished. They have a decreased metabolic rate, lack of exercise, high carb intake because that's cheap and easy and tasty, and hormonal changes in women. Also, don't ever forget polypharmacy when it comes to older adults. Obesity leads to cardiovascular disease, diabetes, risk for undernutrition due to decreased salivation affecting their taste, chewing difficulties, thirst dysregulation, they're just not thirsty, they don't get thirsty, decreased number of taste buds, and cognitive impairment. Constipation is a huge problem in older adults, polypharmacy. So sometimes to increase or improve their function, their health function, is the home delivered nutritional support services, family caregiver support, or having them come to a group site maybe for a meal so they're not isolated and alone. Any questions?